after asking the presenting complaint, you have to ask about the concern. After completing the history, before moving toward the examination, you have to ask about the expectations. And after doing the examination, before moving toward the diagnosis and the management, you have to ask about the idea. Hello, good morning, assalamu alaikum. This is Dr. Faraz Ahmad. So in this video we are going to talk about the ICE. This is very important part of the IPS, interpersonal skills, in your PLAB2 exam. So ICE mean ICE. I mean idea, C mean concerns, and E mean expectations. So if you are going to ask the question regarding the idea, concern, expectations from your patient, definitely you are going to involve your patient in your consultation and you will get very good marks in your IPS. So let me tell you that where you have to ask the question regarding idea, where you have to ask the question regarding the concern, and where you will ask the question regarding the expectations. As in the history, I told you that when you will ask about the presenting complaint of your patient, so right after asking the presenting complaint, before moving toward the DDs, you have to ask regarding the concerns of the patient. Like patient presented with chest pain, you have asked about the presenting complaints. So before moving to the DD's question, you have to ask about the concerns. Like if patient presented with chest pain, the patient concerns will be that it could be a heart attack. So you have to ask about the C question, that is concern question, right after the presenting complaint. Like let me tell you that how you can ask the concern question right after the presenting complaint. You, like patient presented with chest pain, you will ask concern like what are you concerned about more today. Definitely if someone is presenting with chest pain, either it's not a heart attack pain, still patient will be concerned about heart attack. Patient will tell you, doctor, I am concerned about heart attack. Okay, so you will reassure your patient that after asking few more questions, I am going to talk about your problem and your management. So this was all about the concerns. So the other things is about the expectations. So please don't ask about the idea first of all. You cannot ask about the idea before taking the history and before doing the examination. So first of all, after the presenting complaint, you have to ask about the concerns, and after completing the history. After completing the history, before moving toward the examination, you have to ask about the expectations. So you can ask, what are you expecting from today's consultation? So this is the question of your expectations. So this is the second question of your ICE. So first question was concerns right after the presenting complaint, and after completing the history, before moving toward the examination, you will ask about the expectations, and you will ask what are you expecting from today's consultation. So after doing the examination, like you have done the examination, now you have to move toward the diagnosis. You have to tell the diagnosis to your patient, and you have to move toward the management step. So after doing the examination and before moving toward the diagnosis, you have to get idea of your patient. So now I will tell you that how you can get the idea of your patient regarding the problem. You will ask your patient that, do you have any idea what's going on with you? Do you have any idea what's going on with you? Before telling diagnosis to your patient, you are checking the idea of your patient. So what happened that when you will ask about the idea of the patient, in some cases patient will tell you the diagnosis, and this will ease your job. If patient has told you the diagnosis, so definitely you will tell the patient that yes, as you are suspecting, I am suspecting the same, that you are having a heart attack. So this is the way you have to use this ICE in your history taking. So let me repeat, after asking the presenting complaint, you have to ask about the concern. After completing the history, before moving toward the examination, you have to ask about the expectations. And after doing the examination, before moving toward the diagnosis and the management, you have to ask about the idea. So if you will follow this ICE approach, this will give you very good marks in your IPS. Thank you very much.